Over the years, we've learned that for students to learn and teachers to teach, their primary health needs need to be met. Fundamentally, what we've learned is that if we don't provide those needs up front, we miss the opportunity to prevent the onset and course of not only mental health problems, but health problems as well.
Principals had identified a need to have somebody in their building that really knew the families, could connect with them personally, and could help connect them to community resources, because we know there's a lot of resources out there and we know the need is there, but there wasn't this connection.
The Community Care Demonstration Project responds to the needs of Oregon students and families by providing a number of things. One is instruction and support on mental health literacy, and the second in particular is embedding community care specialists in school buildings. And their role is to support students and families in providing access to mental health and health services, but also things like clothing, food, housing, and other things that a student or a family might need on any given day. So the specialists navigate the system. They also interact with local systems of care and develop partnerships with local health agencies, mental health agencies, and other providers in the school environment.
I had a teacher from our alternative school send me an email at the end of last year, and she said, "Thank you for our CCS." She said, "For the first time in 18 years, I was able to completely focus on teaching."
Students aren't falling through the cracks. They're actually getting from one friendly face to another friendly face. It's amazing to have a place to bring it to and then have that connection up to the state.
A lot of the time, families reach out needing health insurance. I was actually able to host OHP workshops, so in person the families were able to come in and learn more about it and kind of soak in all the information, and then also have conversation about what else they need and what they've been struggling with.
Being culturally specific and having students and families have someone within the school that looks like them, that speak the same language, that we can understand each other on a cultural base, has been really good, because they are letting me know what they need and I know exactly what they need, and that allows me and all of us in reality to go ahead and help them back.
We're still working with a lot of fire affected families in the FEMA trailers. A lot of our referrals were for housing and just trying to get them on housing lists, doing research. I learned that if you ask, like, so many people are willing to just give you free things or things at a discount, and they're more than willing to help.
We have a backpack program at our school where we load it full of food and kids come by and pick up that food and they take it home. We've also been able to provide bikes for a couple of kids this year who've had trouble. I know, does this fall under mental health? But it does. It's easier to have perseverance when there's hope.
I think what we're doing is creating that invisible bridge. We're making it visible. It always needed to be there, but it hadn't been built yet. We're like a giant snowball. We do all these little things. Some of them are bigger than others, but then eventually all these things add up and they make a huge difference.
They embrace their community, strengthening their trust in their relationships so that families feel better supported.
They literally save them. I tell them all the time, you're saving lives. We're thrilled that we're a part of it.
We encourage you to learn more about the project so that you can also develop caring, connected communities in your school.